Hello friends, my name is Dr. Ashok Vaid. I work at the Medanta Medicity. I am a cancer specialist. Immense benefit. As I said, robotics has made surgery much more efficient, more patient friendly. Our drugs, on account of newer technologies, have made these medications more precise. Not only patients are responding better, they're also living longer. They're enjoying a better quality of life. Why? Because these drugs are more targeted. And this is only on account of the advancement in our understanding of the biology and in terms of harnessing that understanding to develop better, safer drugs. One downside with the newer medications and newer technologies that they come at a cost. But as I said, this cost increment is also leading to an increment in terms of the quality of life and the longevity of life. And also, to add to that, a lot of new medications are actually oral drugs, oral pills. Patients are taking at home. They need to visit the hospital only periodically for checkups and some blood tests. And even those which are being given by injectable route are the ones which are being given on a daycare basis. Patients take these drugs and go back home, versus the older technologies when patients had to stay in the hospital for longer periods to battle the post-treatment effects. So, in a nutshell, something which is making things happen better is coming at a cost. And I think that's quite understandable. That happens in every other industry as well. What actually spurred the growth of our understanding was the decoding of the human genome. As we got to know the genetic makeup better, this was translated into developing better technologies. And therefore, the research has focused not only on one cancer. The research is on a variety of cancers, and many of these cancers, we are today using these drugs, advancements or medications give to the patient what is called as a personalized medicine. And this personalization of medicine means that every patient does not get the same therapy for the same tumor. The tumor is analyzed and every patient gets his or her own therapy. Also, to put it simply, to each his or her own therapy. That goes to say that one size does not fit everyone. So there is a different size, there is a different therapy based on our understanding of the tumor biology and the tumor environment, which translates into personalization of medicine. So therefore, and many cancers, especially lung cancer, breast, kidney, brain tumors, blood cancers, lymphomas, they are all benefiting from these advancements in our understanding and the application of the technologies. A clear message is that science is advancing. The number of treatments available 20 years back versus 10 years back and versus today, there are many more options, more robust options, leading to better survival and better outcome. And also these technologies are helping your doctors to follow up the patients much better, detect the resurgence or recurrence of the cancer very early on, so that they can change the treatment or give another treatment very quickly. So therefore, depend on the doctors to take a call and apply what is the latest in medical science to each one patient. Thank you so much.